Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the plastic surgery stories of patients? We're here to explore those questions and get some answers with my guest Liam on the Plastic Surgeon Podcast. Hello, my friends. Welcome back, and thanks to our listeners for the amazing feedback. We have had so much fun so far and look forward to more of your insights and suggestions. Please rate and review us on Apple Podcasts to help us get you more amazing content. On the Plastic Surgeon Podcast, we listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand the motivations of why they would risk their life under the knife. I'm Dr. Sajan, and today my guest is Liam. Liam, we're here to talk about your journey, how we came to know each other, the procedure you underwent, and how it's affected you.
Hi, thanks for having me.
Liam, what surgery did you have?
I had top surgery.
And what's top surgery?
Top surgery is when you go into a surgeon and they remove the excess fat that's in your chest. Typically, most female to male patients do this.
So it's a gender-affirming surgery, right?
Yes.
And usually it's fat removal with chest tissue or breast tissue removal, right? And the goal is, as you said, to create a more chest that's affirming for that patient's gender identity.
That's correct.
And there's different kinds of top surgery. Do you remember which kind you had?
I'm pretty sure I had the bilateral mastectomy. So
Exactly.
2 incisions.
Yeah. So we did what's called a double incision top surgery. What that means is we removed about 95% of the tissue on both sides. We removed the nipple and reinserted them and made new nipples for you, right?
Yeah.
How long ago did we do that, Liam?
I had my surgery August 10th.
Awesome.
Of this year.
How has it felt since?
It's been amazing. Whenever I put on a shirt now, it's just, I don't think it'll ever get old to see my chest and not seeing what I used to see before. It just looks flat. It looks like there's pecs there. It's awesome.
That's so cool. It makes me so happy to see that.
Thank you.
See your face when you talk about it. And when you used to look at your chest before the top surgery, do you mind sharing with our listeners, how did you feel?
I felt just really out of place. I felt like that wasn't me. I remember when my chest first started to grow in back in 4th grade, it was the most traumatic thing for me. I was just completely distraught. I didn't understand why they were growing. Because I guess, to me, I never really understood that there was a difference. I always wanted to go around without my shirt, but my parents would tell me that that's not okay because I was a girl. And to me, that just wasn't the case.
And what's your gender identity, Liam?
I identify as male.
What is gender identity?
Gender identity is how you feel on the inside. A lot of times, for most people, their outside doesn't match their inside. And for me, growing up, my outside never matched my inside.
Okay. When did you know that was the case?
I think I always knew. I just didn't have the word for it. I was born in Dominican Republic, so we didn't really have, transgender people, nor did I hear about it until I was, in high school. Yeah.
And when did your family move to the U.S.?
They moved to the U.S. when I was about 6 years old, so sometime around 2000... some early 2000s. I can't remember exactly when.
What feelings were you getting that your gender assigned at birth wasn't congruent with you?
Whenever my mom would try to put me in a dress, would try to put me in a skirt or anything like that, it would make me feel like I was there was a box, I was in a box, and I felt just closed up. I couldn't see anything. I felt really stressed out all the time. My hands would get clammy all the time, and I didn't understand why. I would see my brother going out without his shirt and being totally fine, and I wanted to do that. I wanted to look like that, but having to wear a dress and having to put on a bikini, it just wasn't for me. It would make me slunched over. I never walked with confidence. It was just traumatic.
What age did you first feel this?
I would say I was in kindergarten, so maybe can't remember exactly how old I was in kindergarten. Very early.
Was this in the U.S. first or Dominican Republic?
Dominican Republic first.
Did you say something to anyone?
No, because I didn't know how it felt. I didn't know what it was either. I just assumed that I just didn't like those types of clothes. My parents just figured, it's okay. He'll outgrow it. But I just never did.
When did you start figuring out that your gender identity wasn't congruent? When did you have the words for it?
I would say I learned it in high school. Yeah, so I would say junior year, that's when I first started hearing people that were transgender, and I would look it up online and try to see if that's how I felt. But I had a friend that I felt like I didn't have the exact experiences as him, and so to me it was like, oh, well, I can't be trans because I didn't have the exact experiences.
In high school, how did you learn somebody else was trans? Did the teachers announce it? Did the other students say it?
Yeah, so a lot of students would gossip, and you'd hear about the one kid in school that was trans and, used to be a girl and is now a boy, or vice versa. And to me, I always thought that was fascinating. And I wanted to talk to them, but I didn't know how, so I just didn't talk to them.
And was it a formal announcement, or was it just gossip?
It was just gossip, yeah.
And you went home junior year when you started hearing about this. You did some research.
Yeah.
What kind of online sources did you go to?
Honestly, nothing that was verified. It was just a lot of YouTube, a lot of just Google searches, a lot of Twitter searches, everything like that, yeah.
And the teachers never addressed it or talked about it in any classes?
No, they were pretty much just telling us to, this person doesn't use these pronouns anymore. This is their new name. Let's please address them as such. And we were all like, well, okay, cool.
Was it Seattle public school system?
Yep, back in Shoreline.
Oh, I see. So the teachers made this announcement, and everyone accepted it. Was there any picking on or bullying that you saw?
Not that I ever saw, no.
Then, did you ever approach one of these fellow classmates who had a change in gender?
Yeah, I wasn't friends with them though. To me, it was just another person. I didn't see any difference. It was just like, they use a new name now. They use different pronouns, so I'll just address them that way.
And were these people trans male or trans female, or was it a mix?
I met a lot of trans males, not a whole lot of trans females.
How many people was it in your school or your class?
So I don't think there were really any in my class that I knew about. There were a lot of younger people. I think maybe in my class there might have been one, but I think they were more trans masc rather than identifying as male. And I didn't really know the difference back then, so I just assumed, male.
Mm-hmm. Did you ever approach one of these fellow classmates or students?
I didn't, honestly. I just didn't know how to talk to them.
And you started doing online research.
Mm-hmm.
What happened next in your journey?
My parents would constantly ask me, this was like back even in like elementary school, they'd always ask me, are you trying to be a boy or something? And they'd say it with like a bit of jokingness, but to me I kind of felt like it was like a punch being thrown at me, and I didn't know why. And I told my mother a long time ago, I think back when I was in 5th grade, that I liked girls, and she's like, oh, it's fine, it's just a phase, you'll outgrow it. And it just never really did, and I was like, well, maybe I don't like girls, maybe it's just a phase, as she said. But whenever I saw boys, I never liked them. It was just that I wanted to be them. I wanted to look like them. It was never that I had any real emotions towards them. So I couldn't take it anymore. I stopped wearing the dresses. I stopped wearing skirts and anything like that. I was very much into sports, so that helped a lot. I was able to wear sweatpants and sweatshirts whenever, which helped with my chest.
And what age was this at?
This was high school, so junior, senior year. So I was about 16, 17, yeah.
And when did you start coming out to people?
I started, I think 2020, Yeah, I started fully coming out to people and telling my close friends. I think I might have officially transitioned socially to everybody around me 2021.
Were you in school then, or were you done with high school?
I was done with high school. Yeah.
So you've graduated high school as someone who's assigned female at birth?
Yep.
Were you identifying as gay or anything else at this point?
No, I had a really weird association with the word lesbian, so I didn't ever use that because I didn't really date many girls either. I didn't really date anybody, but I definitely did not want to be called lesbian because to me that meant I was a girl, and in my mind only girls are lesbians. So that was not something I ever wanted. I didn't even want to be called a tomboy. The only thing I ever liked about being called a tomboy was the boy part. I liked when people confused me and misgendered me back then, and they'd say, "Oh, this little boy," but to me it made me super happy, and my parents would be like, "Oh no, that's a little girl," and then I'd get all upset about it. But yeah.
Did you go to any school dances or social functions with like a quote-unquote boyfriend or girlfriend?
No, I always made a point to skip those. I never wanted to go because I never wanted to have to wear a dress. I never wanted to have to wear makeup or anything like that. I did have to for graduation, but I didn't really have a choice. My parents wanted me to attend my graduation, so I had to wear a dress and I had to wear makeup. And it wasn't much, but to me it was a huge difference. This wasn't me, and I was just putting up a front.
When you first came out socially, did you tell your parents or your friends?
I told my roommate first.
Were you in college at this point, or were you working and living?
I was just working and living. I had moved to Bellingham at this point, so I had been living away from my parents for about like 2 years, or maybe a year or something like that. And I told my parents second, and then after I told my parents, I told everybody around me. So my acquaintances, my boss, all of that.
What did your parents say when you told them?
I'll be honest, they weren't super accepting at first. They thought I was confused, specifically my father. And then later on, I think they were just scared. My mom told me that, she'll be honest, when she was pregnant with me, she was certain that the doctors were going to tell her that it was a boy. But she was confused when she delivered me and the doctors were like, here's a little girl. She felt like that was wrong, but she didn't question it. And to me, that was a huge telltale sign that I was meant to be a boy my entire life.
And what did your dad say?
My dad, he just said that I didn't know myself. And that was something that hurt, but I knew myself. I knew that I felt like this since as early as I could remember. I just didn't have the words for it.
Were your parents both Dominican?
No, so my father is American. I think he was born in New Hampshire or Connecticut. And my mother was born in Dominican Republic.
And he met your mom when he was there, I'm assuming? What was he doing there?
He was working in the Peace Corps.
Oh, wow.
Yeah.
And then they got married and they came back together.
Yeah.
When you were in kindergarten. And how did you address this incongruency with your dad?
I stopped talking to him for a little bit. I was raised in a pretty, I would say, harsh environment in a way. My dad was raised with a military family, so he's very strict. And so I kind of had that in the back of my mind, and I was just like, okay, well, the only way for him to understand this is to be strict. So I stopped talking to him for a bit. Whenever we'd argue, I'm done talking, hang up the phone, or block him for a few days. But since then, we're all very, very, very close. They all understand, they all accept me, and they address me correctly and no mistakes.
Was religion an important part of your childhood or your life?
I would say it was there, but it wasn't like super, super important. Yeah, not super, super important.
And it sounds like your mom accepted.
Yeah.
And your dad now, he's accepted it?
Yeah.
How did he get over that hump, or what did you do to help him get there?
I'm not entirely sure. I think my mother might have helped him because I wasn't living with them at the time. So I assume they had a conversation within themselves, and I think their love for me was stronger than, what they thought I was supposed to be.
Mm. How many siblings do you have, Liam?
I have two others. I'm the eldest. I have a 21-year-old brother and a 9-year-old sister.
And your two siblings, are they cis?
Yes, they are. Mm-hmm.
How did they feel about this?
They didn't have any bit of concern. They didn't think there was anything different. My brother, when I first told him, he was excited. He was like, I've always wanted an older brother. So that made me very happy. My sister didn't care because she was 9.
And right now, how's your relationship with your dad?
It's great. Really, really great.
Do you have extended family that knew about this?
Yeah, so my family in Dominican Republic, they all know. My grandmother's actually here from Dominican Republic. She's visited the States for the first time in her whole life, and she loves it, and she addresses me correctly, even though I haven't seen her in like 10 years. But everything's great. Everything's great.
And when we think about transition, there's multiple phases is the way I think about it. Mm-hmm. People will often first do a social transition.
Yep.
And what that means to me, how my patients have described it, is they'll come out to the people around them. Then oftentimes they'll change the way they present.
Yep.
And the way they dress, the way they act, the way they walk, the way they come out to society.
Mm-hmm.
And oftentimes, shortly or after some period, people will start hormone and medical transition. Did you start that?
Yeah, I'll be honest, I actually started my appearance right after high school. So my appearance completely changed. And it gradually changed as I went through high school. But as soon as I was out of there, I was, no more dresses, no more any of this, just sweatpants, and I would buy from the men's section. Sorry. Bless you.
And did that happen more when you moved from your house?
That's exactly it, because I had, my own money. I didn't have my parents to judge me, so I would just always go to the men's section. Every once in a while, since it was before I came out, I would get something from the women's section, I think just to hang on to that little piece, to appease my parents. But I never wore them. It was just sitting there in my closet collecting dust. But yeah, I wore men's jeans, men's shirts, men's boxers, men's everything.
And how long after you socially transitioned did you think about medically transitioning?
I always wanted to medically transition. And so as soon as I socially transitioned, I think I waited, I would say, probably a couple months, and then I started testosterone. I think I started testosterone in 2021? Yeah, 2021.
Was it hard to find a provider?
No, actually, I used Plume, so it's a telehealth medical thing, and they've been great. I started testosterone immediately.
How did that feel when you started T?
I was to the moon ecstatic. I was so excited. I would say every day I went to the mirror to check to see if I had another little hair in my mustache or beard growing. But yeah.
What were some of the changes you started to see?
I think the first thing I noticed was my emotions. I was happier. I felt lighter. And then I noticed that there were some other more physical changes, like the sound of my voice. My period stopped coming after a month and a half. I also noticed bottom growth. That was pretty quick.
Mm-hmm. Do you mind sharing what bottom growth is?
Yeah, bottom growth is when I guess your downstairs enlarges. So for most people, I don't know.
The clitoris enlarges, correct?
Yeah, their clitoris enlarges. And it varies for different people. Some people it gets larger, some people it doesn't grow at all. Yeah.
And did they require the Plume and telehealth people? Did they require you to get any counseling or therapy before hormones?
No, because I did start therapy just for my parents because they felt like before I start anything, before I, tell anyone anything, that I should go to therapy. And I had already told everybody, but I was like, sure, if you want me to go to therapy, that's fine, I'll go to therapy. And my therapist was like, yeah, you have gender dysphoria. It would be recommended that you start testosterone. And I was excited. I already knew, so.
And did you find a therapist, or did your parents recommend it?
My parents recommended that I try BetterHelp,
Mm-hmm.
and so I found a therapist through BetterHelp.
Was this someone who specialized in gender stuff, or just someone who was there online that was available?
It was just the person that was available. I tried to find someone that was more in the LGBTQIA plus community, but sometimes that doesn't really help. The person I had was super, super kind, but I guess they weren't a mental health expert, so in order for me to find that, to get top surgery, I wanted to make sure that I had someone that was a mental health professional. So later on, I found a different therapist.
Oh, I see. Liam, did you learn anything new in therapy?
Honestly, I really didn't. I would say that I know myself extremely well, so whenever they told me something new, I already knew it. You know, I already felt that. I grew up having a lot of anger issues, mainly because I didn't know how I felt growing up, and so I would just bottle everything up. But after hearing a therapist tell me that I needed to work on my anger issues, I already knew that. I was already trying to work on that.
What kind of anger issues did you have?
I would really hold grudges. So whenever I would, even just drop my phone, it was to the point where I wanted to punch a hole through the wall. And I think it was just, I was dealing with other thoughts. It wasn't just the fact that I dropped my phone. It was the fact that I was stuck in a body that wasn't mine.
Did testosterone make that more?
It did. It helped. It helped a lot. So I originally heard that testosterone was supposed to heighten your anger, but for me it did the complete opposite. I was just happier. So my anger, I didn't just hold everything in anymore. I spoke to my friends about my feelings, and it just helped a lot with my anger.
How soon after you started testosterone did you start thinking about surgery?
So I always wanted top surgery. I knew that for a fact. I think with my roommate, I probably told them that I wasn't sure. I wanted to see how testosterone was going to affect my chest, because I know that sometimes it gets a little smaller. But to me, I knew for a fact I wanted top surgery. I wanted my chest to look a certain way, and I knew that no matter how hard I worked on my chest, testosterone wasn't just going to fix it.
Is your roommate part of the LGBTQI community, or are they cis?
They're cis.
Okay. And your roommate knew about your gender transition, I'm assuming?
Yes.
Supportive?
Very supportive, yeah.
And when you started thinking about top surgery, that you always had been, what made you decide now was the time?
I'll be honest, a huge factor was the fact that I was 24 at the time. So I really wanted to make sure that I got my top surgery before I turned 26, because I wanted to stay on my parents' plan. And I know that top surgery is expensive. I was trying to save up, but I just wanted to make sure I got it done before I turned 26.
How did you start researching surgeons who do that kind of work?
I looked at other trans men and how they started looking, and I just started looking for surgeons in my area, because I thought about looking outside the state, but the prices were way too high, and I wanted to keep things local. And then I saw you and Dr. Tony, and I'll be honest, I did reach out to Dr. Tony first, mainly because I just didn't know a whole lot about you at the time.
Sure.
And I found out that he didn't take my insurance for some reason, and so I reached out to you, and I looked more into your results, and I was blown away. You know, especially people that have melanin. I wanted to make sure that I was okay with how their scarring is, even though mine probably wouldn't be the same. It actually hasn't been the same at all. But I was just blown away with your results, and so I just booked a consultation.
That's cool. Did you see some of the stories from our patients or any of the videos before?
No, actually, I didn't. I just saw your results page, and that was all.
That's cool.
Yeah.
And how did you make the call for the consultation? What led to that?
I was nervous. So I went onto your website, and I messaged, there's a little talking circle there.
Yeah.
So I asked some questions on there, and they were like, well, you know, the best way to get to know him is to make a consultation appointment. And so I was like, well, let's do it. And I did it, I think, that very day.
That's awesome.
Yeah.
Did you have to wait a little bit, or was it pretty quick to get in?
It was pretty quick.
Okay.
I would say it might have taken me like maybe a week.
Okay.
Yeah.
And then you came in for the consultation,
Mm-hmm.
and we, how was that experience?
I was nervous. We went to your location in Seattle,
Mm-hmm.
and I hadn't been in Seattle in like a long time since I moved out of my parents.
Mm-hmm.
So it was just really exciting being back and actually doing something that I wanted to do this time and talking about my future. So I was very excited.
How was it the night before the consultation?
I couldn't sleep. I was awake all night.
What were you thinking about?
Just what if it doesn't work out? What if, for some reason I'm not the right candidate? I wanted to get keyhole surgery originally,
Mm-hmm.
but my breasts were just a little too large for that.
Mm-hmm.
And I wasn't entirely sure how I was going to feel about having 2 incisions that big
Mm-hmm.
on my chest, but I needed this, so I didn't care how the scars came out.
I understand. I think so many patients who want to undergo top surgery, oftentimes in the beginning, they're just used to so many gatekeepers, and they're so scared of the system.
Yeah.
Because of all the history that we have, especially people of color, I would say.
Mm-hmm.
And so their worry isn't, I want the best. Oftentimes their main motivation is, I just want this done.
Yeah.
Right? And I think for many providers, unfortunately, that's all they try to do. They just want to get it done. And I think for me, it's beyond that, right? When I have the privilege of meeting someone like yourself who's interested in top surgery, my goal isn't, can I do the surgery? That's really never my goal. My goal always when I meet patients is, how am I going to meet this person's expectations? And my real goal is, what I'm asking myself is, how am I going to exceed their expectations? How am I going to do more, be more, and really create something that's going to complement this person's life? Right?
Yeah.
A lot of people know how to cut, and a lot of people know how to stitch.
Mm-hmm.
The hard part, I think, with top surgery, the real challenge is understanding the psychology, the physiology, the biology, and the anatomy to create a chest that's going to be with someone for the rest of their life, right?
Yeah.
So when I'm making these cuts and I'm making my incisions, sometimes when I make my videos, it looks routine, right? Sometimes it's entertaining to watch because I'm a little bit of an animated person. But in my mind, I always remind myself, every move I make, every cut I make, every decision I make, this person's going to live with for the rest of their life, and there's no turning back, right?
Yeah.
And so I think that's the important thing. I think that's what separates people who do amazing top surgery from people who just do top surgery, right? Just doing top surgery means, okay, cut out the tissue, stitch it up, put a drain in, send them home,
Mm-hmm.
right? Doing amazing top surgery for me means creating shape, form, and figure that someone's proud of. That's what I try to do.
Mm-hmm.
So with your surgery, did you have drains?
I did not. No, I was actually really worried when I first found out that you did drainless top surgeries,
Mm-hmm.
and I was a little skeptical. But I was like, just trust the process.
Yeah.
His results are amazing.
Yeah.
So, and you don't have that large of a chest either. So just go for it. Just trust.
Yeah.
Because I have a very hard time trusting
Mm-hmm.
people, and I just put all my trust in you, and it turned out marvelous.
Oh, thank you. What made you want to trust me? There's something must have clicked or not clicked.
It was just the way you spoke to me. You genuinely seemed to really care. And it wasn't just, okay, well, this is another paycheck, another patient just to add to my tally. This was, genuine for you. And I could sense that. And I wanted to trust you.
That was awesome. Thank you. So we had the consult. How did that experience go? Because I know you came in thinking, I want keyhole. And what keyhole is, it's a little different than double incision. So with the keyhole, especially in people of color, it's really nice if you can do, because you just cut underneath the areola. It's a little half circle. And when you make that incision between the areola and the skin, there's no real scar you can see.
Yeah.
Because you hide the scar at junctions. So when you place incisions between junctions in the body, what happens is you can't really see it because it'll look like a transition. Yeah. So you're always expecting to see a line between the areola and the chest skin. So when that cut is there, everyone's like, oh yeah, it's normal, whatever. You don't see it, but it's still a cut in the scar, but it's very slight. Mm-hmm. When you make scars through an entire anatomic zone, like the pec, there's no transition, right? So you see that cut through and through. Mm-hmm. So the keyhole is oftentimes better if possible because there's no visible signs oftentimes. It heals quick. I don't do drains with keyhole. I think I'm the only person who does that in the world that I know of, drainless keyhole surgery. And then you heal. The challenge with the keyhole that we talked about was you can't have a really wide areola or a lot of skin and tissue, because if you have that, it ends up looking botched, in my opinion, right? What happens is, in a keyhole surgery, you're not removing skin, but you're removing gland. Usually you're not removing areola. So what you're hoping is everything will shrink around the internal contents that you remove. And there's two ways to get away with keyhole in somebody who's not a candidate. Way number one, leave a lot of tissue and give them just a small breast, which looks horrible. And I do revisions for other people because of that, not my own. And way number two is you just remove a lot of tissue and hope and pray the skin heals. And usually it doesn't look nice, right? So we talked about that.
Yeah.
What did you feel about that when I said, I don't think you're a keyhole candidate, we should go with double incision?
I was a little disappointed, mainly because I had seen other, bilateral mastectomies done, and I just didn't want the scar. I didn't want us to have something so large on my chest, especially since I didn't know how I was going to feel about it. But, I went home and I thought about it, and I looked at more top surgery results of double incisions, and I was just like, I want this. I need this. So I don't care. And so I just went for it.
Why didn't you get other consults to see if other doctors can do keyhole? Because usually I'll tell people, I'm giving you my opinion, and you can also get more. Nothing wrong with that. I'll even help give you names. But what made you not want to do that?
I didn't like the results that other people had. Those other surgeons that did the keyhole surgery with larger breasts, it didn't look the way I wanted it to look. The areola was either too big, or, in my opinion, or I didn't think I was going to be happy. I wanted something that was going to suit me, and I trusted your results. I trusted your opinion, so I went with that. Thank you.
So day of surgery came. How was that day?
Very, very nerve-wracking. Again, I couldn't sleep. Couldn't sleep.
And you're a smart, kind, loving person. But I can, I see so many people. I understand personalities. I know that you are cautiously skeptical, not in a bad way. I'm not saying negatively, but you question things to make sure you're making right decisions, right? Which many people do. And did you have any doubt day of surgery?
Not the day of surgery. After I got the surgery done, when I was conscious, I think this was just a few days after surgery, I was just like, did I make a mistake? Is this, what I did is irreversible? Did I make a mistake? And I told my roommate, and I just, as soon as I said it out loud, I was like, no, I didn't. This is something I've always wanted. My chest looks great, and it will heal greatly if I listen to what you said. And that's what I did. I just paid attention to your instructions to the T, and my chest looks amazing.
Awesome. Thank you. Did you use our SCAR protocol system?
Yeah, I'm on phase 2 right now.
How's that been going for you?
Really, really good. The first one was with the shower and the cream, and it was a lot of, I thought I was going to forget to be able to do it twice daily, but I think it's just routine for me. I want this to look the best possible. I want my scars to go away as much as possible, so I don't really have a problem with it at all. And I like the smell, I'll be honest. The smell of the SCAR protocol, it smells really good.
Awesome, thank you. So the scars now, so with the top surgery, you do have a big scar that goes from basically the midline all the way to the side towards your armpit. How is that scar going for you right now?
Really good. At first, I was a little nervous because it was just a little, I would say a little thick with the scar. And I went to you and you explained that, with people with melanin, the scar will flatten out over time. And it has done that. I've seen that. But yeah.
And the reason it was thick, so I can explain to everyone, is so when you do surgery, you can't think about what it's looking like on the table. You got to think about long term. So why do my incisions oftentimes look thick right away on the table? The reason for that is there's a concept in wound closure in plastic surgery called eversion. What that means is when you stitch the wound, you want it to be raised when you're done like this, like a little pyramid. Because what happens with time is all wounds stretch. So if you don't make it raised, when it stretches, what happens is it gets wide. And you get that little squiggly line that's pretty thick. So when you're closing on the operating room table, what I do, and I've taught my assistants who help me, is you always want it to be bunched up. Because that bunching compensates for that stretch you'll get over the next year of healing. And so, and that's what you saw, is that it looked a little thick, it looked a little raised right away after.
Yep.
And the reason for that is to compensate for that stretch you'll get. Mm-hmm. And people often ask, well, why do people of color get thicker scars? Well, what happens is people of color, when they heal, oftentimes they'll make more collagen. And when that collagen becomes too thick, you can get what's called a hypertrophic scar. Now, a hypertrophic scar is a thick scar that's within the incision. But sometimes you've heard of keloids, right?
Yes.
And keloids happen when the scar grows past the incision. Okay. So to help prevent that, you have to have less wound tension, you have more eversion, and then we do healing things like scar protocol to make sure that the wound is optimized for its continued time. So are you feeling like you have a keloid or hypertrophic scar right now?
I don't think so. I was actually really worried that I was going to develop a keloid scar, because I just, you just never know. Mm-hmm. You might, who knows, but it hasn't.
So you had this initial doubt after surgery.
Mm-hmm.
You questioned it out loud. It got better.
Yeah.
Has that come back at all?
No, not one bit. It was just a split, 3-minute conversation, and that was it. It just, I knew I didn't make a mistake.
When you were undergoing this process, some people say hormones are sort of reversible, sort of not. Mm-hmm. Social transition is somewhat semi-reversible. When did it hit you that surgery is completely irreversible?
That moment that I doubted myself.
Afterwards?
Yep. That same very moment, I was like, I will never be able to go back if I decide that this was a mistake. But after I realized that it wasn't a mistake, that just never came back.
And how has life been after?
It's been fantastic. Absolutely fantastic.
What can you do now that you couldn't do before surgery?
I can wear any sort of shirts. Before, I used to avoid the color white, so I would never wear a white shirt just because I felt like you could see my chest more. Mm-hmm. I stuck to more dark colors and specific textures too, just so you didn't see my chest very well. Now I can wear whatever shirt I want, whatever pattern, any sort of texture, and I'm proud.
That's awesome. Have you gone shirtless anywhere in public?
Not yet. I'm trying to keep my scars away from sunlight as much as possible. I think I might have gone into a pool once, and it was just I just sat there when it only covered about a little bit above my belly. And that was it, because I just didn't want to take any chances. I know I'm being extra cautious, but I'd rather it come out the absolute best possible.
When you were sitting at the edge of the pool, do you feel people were looking at you different or staring at your chest?
I thought that originally, but no, I realized that nobody was looking. Nobody cared. Mm-hmm.
Do you think you could have done that before surgery?
Yes, probably. I had a small enough chest, so it looked like gyno, to be honest. And I think there's a lot of cis males that have gyno. And so to them, when they saw me with my chest, they didn't think much of it. They were just like, it's just another guy with gyno.
When you were sitting at the edge of the pool, you initially felt people were looking, then not. What made you, was it just that you took time to look around the room to feel that out?
Yep. I took time to look around the room and see if anyone was staring at me the way I would assume people would be staring at me, but they weren't.
Many patients, they undergo surgery also as a process of changing their gender markers. Did you go through any of that?
I did all of that before my surgery. I actually recently got my new passport that I had to renew, because that was the last step in changing my gender marker and my name on my passport. And I finally got those, so I'm done changing everything.
And using the bathroom, was that ever a thing for you, or were you always comfortable with using the bathroom as you saw fit?
I would say the first couple months of coming out socially, and I started using the men's restroom. This was before testosterone. I was a little scared just because I would hear a lot of trans folks talk about how it was scary or people would stare at you. But I realized the complete opposite. Like, I think most people that are going to the bathroom, they don't really care. They just want to get into the bathroom, do their thing, and get out. Mm-hmm. And that was exactly the case.
Are there any more surgeries that you're thinking about?
I have thought about bottom surgery, but I just personally just don't think that I'm ready for that. I want to wait until they perfect the surgery more. Mm-hmm. I hear that there's just too many complications, too many scarring, and I don't think that I'm ready for that yet. Not until they perfect it more.
When you look back at your journey, what's one thing you would share with others who are thinking about the same?
I would say just be patient and find people that you trust. Find people that care about you, and just look at your best interest. It doesn't matter how it affects them. They just look out for your best interest.
How do you find people like that?
Honestly, it's difficult. I would say that those types of people, they come to you. You can't search for them, because if you do, you're not going to find the right people. The people that care about you will stick around, and they'll make themselves known.
Who cares about you the most, Liam?
My family and my roommate, honestly. Yeah.
How did you meet your roommate?
We went to school together. We met sophomore year. That's when I moved to Seattle. Mm-hmm. Our life was just oddly similar. She was actually the first girl I had a crush on all through high school. And we did date for a little bit. But I think once I started testosterone, I just needed to be on my own. And so we broke up, and we've just been best friends, supporting each other along the way. And she's been my caretaker through my surgery, and she's been amazing.
That's awesome. Have you been in any relationships since you've transitioned?
Not since Crystal, my roommate, no.
Okay. Is that something you're thinking that may happen for you, or you're just taking it one day at a time?
I don't think so. I'm happy being single and focusing on me and being happy with my chest. This is just, I want to spend time with me. And I think this is the perfect time to do so.
That's cool. Yeah. And right now, I know you shared with us, you have, you work in sales.
Yes.
And you're a pharmacy technician, correct?
Pharmacy technician assistant.
That's cool. Did you do any school after high school?
Yeah, I was actually going to be a lawyer. My dream was to become a federal judge. And I played a lot of sports, as I said before, and I got a really bad concussion. So I had to drop out of college and just take time off. And by that point, I was struggling mentally, so I decided that I was going to do my second passion, which was real estate. And I tried to do that, then COVID hit, and it was too much. I had to work too much in order to make up for what I lost before. And then I decided to just apply to Walgreens, and I got that job. And then I just not extremely happy with it, so I decided to keep looking, and I found the sales job, and I've been pretty happy since then.
That's cool. And where were you going to college?
I was going to college. Where was I going to college?
Yeah.
I was going to Shoreline Community College.
Do you think that's something you're going to look at again?
Yeah, in the future. I still want to be a federal judge someday, so that'll be on my bucket list.
That's cool. Thank you so much for being our guest today, Liam.
Thanks for having me.
Your story is so thought-provoking. It really helps me as a provider, and I think it's going to help our listeners understand the unique lives our patients come from. It's so important to understand and always know that the people as a provider that I have the privilege to serve is someone with a family, someone with a mom, someone with a dad, with a brother and a sister. And understanding and always keeping in mind that every move we do is irreversible. And every move we do has tremendous impact on people. Thank you for that.
Yeah.
I have learned a lot. I know your ordeal will teach our listeners how and what to expect as they go on their own plastic surgery journeys. I appreciate your time, and I'm honored to have you as my good patient, and I would say friend.
Thank you.
Liam, if there's one thing you could share with others about your surgical journey, what would it be?
Just take your time. Enjoy the process because it's a difficult and long process of healing. And just take your time to really reflect on your life and picture what you might want in the future.
Thanks for listening to the Plastic Surgeon Podcast, and please rate and review us on Apple Podcasts to hear more great content. For my live surgeries on Instagram and my adventures throughout the week, catch us on all social media at realdrseattle. Dan, what?